it is act from by some. We divide this digestion and absorption from section by section. Okay, it is started from digestion in mouth and stomach. Okay, these of our fat molecules, fat lipids present in the diet. Now in mouth there is lingual lipase is basically as the term you comes in your mind, lipase, that means the enzyme which is act on lipid molecules. Okay, and how it is comes? It is comes by the dorsal surface of the tongue, where Abner's glands are present. Where Abner's glands are present, or we also called lingual serous gland. Lingual serous gland. But as we take the diet, the first bolus comes in our mouth. The bolus is not retained for 2 to 3 hours in our mouth. So these lingual lipase is not digested lipid more amount. These lingual lipase not digested these lipids in more amount. But in some of the cases, some of the infants, there is presence of short chain fatty acids and medium chain fatty acids. That you already know. It is what? That means that contain 10 to 12 carbon molecules long chain fatty acids. It is short chain fatty acid and medium chain fatty acid, which is generally present in the milk, are sometimes digestible in the mouth due to presence of lingual lipase. Okay, firstly thing is that. Second one, there is lipase, gastric juice, which is present in gastric juice, and last one is pancreatic lipase. Okay. Firstly, you understand the terms majorly of bile salt. Okay, these bile salts sodium glycolate, toripolate. There is another term called micelle. So before going to study all these things, we easily understand. If we take these fat molecules, student, try to understand what I will describe you. Before that, before you understand the process of digestion, you understand the basic terms. Okay, these are the fat molecules and these fat molecules firstly converted into a small droplets. These are the small droplets, and we call these fat droplets. How it is converted into a fat droplets? By the process called emulsification. Emulsification. It is very easy to understand. Emulsification process. How the emulsification is produced? It is done by biological detergent. What we call biological detergent? These bile salts are biological detergent. And what is the property of detergent? It emulsifies. Okay. These bile salts act on it, and due to this, there is a formation of vessels. And firstly, it is converted into a small fat droplets, and on these molecules, there are several enzymes act on it for further breakdown. Several enzymes act on it for further breakdowns. Now, micelle. Now see, that is digestion in the mouth and stomach. The firstly, there is no digestion occur in mouth and stomach. It will say that no digestion occur, but sometimes because there is a presence of lingual lipase, which is also act on the fat globules, and the bolus, the present of lingual lipase act on small chain fatty acid and long medium chain fatty acid. Sometimes molecule become neutralized. They lingual lipase become neutralize the bolus, and these bolus going to the small intestines, where these dietary fat is emulsified by bile salt. In jejunum part, there is a presence of some enzymes. These bile salt firstly emulsified, then some enzymes, we call these enzymes as pancreatic lipase, cholesterol esterase, phospholipase A2 and lysophospholipase. These enzymes act on separately on separate molecules. But how does act on these molecules? Have you done Hay sulfur test? What is the property of bile salt? Yeah, they break down the surface tension. Same as in this molecule, they break down the surface tensions, and there is esterification processes occur. What is esterification? If you see the TG molecule, there is ester bond between all TG molecules. This is the molecular structure formula of triglyceride, and here the ester bond is present. The fatty acid, long chain of fatty acid are attached with this glycerol molecules. This is only a glycerol molecules. When the three fatty acid chains are attached, it is called triacyl glycerol or TG. Okay. So firstly we take the TG in the diet directly. So there is process called esterification occur. Esterification, and it is majorly done by enzyme lipase. By lipase. So what is basically happening here? Is can break down these molecules only 2 MAG two monoacyl glycerol plus free fatty acid. It break down this molecule 2 monoacyl glycerol plus free fatty acid. Okay. So this is the main enzymatic reactions and lipase, role of lipase basically. Okay. That is hydrolysis, because all these are what? All these are lipolytic enzymes. They act on these lipid molecules. Firstly they esterified, they convert these lipid molecules as 2 monoacyl glycerol plus fatty acid. Okay. So these pancreatic lipid enzyme, write down the name of these enzymes. The first one is pancreatic lipase, cholesterol esterase, phospholipase A2 and lysophospholipase. Pancreatic lipase and phospholipase A2 and lysophospholipids. Now, how they act on phospholipids? Because we take in the diet triacyl glycerol, which is converted into 2 monoacyl glycerol by lipase activity, and free fatty acid. Now, phospholipid are digested at pancreatic phospholipase A2. This is another enzymes which act on phospholipid, majorly in glycerophospholipid, and it converted these lysophospholipids plus free fatty acid chain. Okay. Same as for cholesterol ester. The cholesterol ester hydrolyzes by pancreatic cholesterol esterase, which produces cholesterol plus free fatty acid. Same as again the CE is by the enzymes cholesterol esterase, it forms cholesterol plus free fatty acid. So there is esterification processes occur. Esterification process is what? Removal of fatty acid chain from a particular molecules, and it is happened by esterase enzymes. These esterase enzymes are lipolytic enzymes. Okay. The question is that why free fatty acid they can remove this free fatty acid chain? Because we utilize this free fatty acid chain for further process. Okay. Now, product of lipidization, micelle formation. It is free fatty acid, free cholesterol, 2 monoacyl glycerol and lysophospholipid. These are the least product. Firstly, you understand What we take in the diet? We take phospholipid, we take cholesterol ester, we take triglyceride. Okay. Firstly, it comes in the mouth. In the mouth, there is the presence of lingual lipase, and lingual lipase is generally secreted by lingual serous gland, which is present at the dorsal surface of the tongue. Okay, which act on bolus, but due to bolus is not retained in the mouth for 2 to 3 hours. It is only generally for 30 to 40 seconds. Okay, it is going to small intestine. It is going to small intestines. In small intestines, there is another lipolytic enzymes are present, which we call pancreatic lipase and gastric lipase. Okay, and these pancreatic lipase, what is do? They done the process first, esterification. Esterification means there is removal of fatty acid chain from particular molecules. Now we see one by one. From triglyceride, it forms 2 MAG plus free fatty acid. Same as glycophospholipid, it forms lysophospholipid plus fatty acid, and cholesterol esterase, cholesterol plus fatty acid. Now they having separate name because they act on this molecule under separate positions. Okay, so that's why phospholipase A2 and some other names are given. Okay. Now after the formation of this product, we call these molecules as methyl molecule. After the formation of this product, there is another process called absorption, and these absorption occur in intestinal lumen of intestinal mucosal cells. Intestinal mucosal cell. These together with bile salt form mixed micelles. Okay, so before going to start, we understand what is the meaning of mixed micelles. What is the meaning of mixed? Have you understand what is the meaning of micelles? There is a formation of G. First one, student don't talk. 2 MAG plus it can change phospholipids, it can cholesterol ester is converted into cholesterol, and these makes a combined molecules. These makes a combined molecule with this is called mixed micelle. Okay, this is called mixed micelle. Basically, why this formation of mixed micelles occur? For the transportation. For the transportation purpose, it forms the mixed micelle because bile salts having the property of this esterification, bile salt having the property of emulsification. So due to this forming micelles, and these micelles transported in the blood for further absorption process. Okay. After the formation of 2 MAG, cholesterol ester, free fatty acids, lysophospholipids, the next process is absorption. Let me see, it is occurring in the intestinal mucosal cells, and all these are intestinal border. It is called brush border membrane. Okay, let you see in intestinal lumen, the 2 MAG, 2 monoacyl glycerol is directly absorbed and it is resynthesized. What is the meaning of resynthesize? 2 MAG is converted into Tg. So student, understand this, what the meaning of and if there is attachment of free fatty acid chain forming the molecule Tg, it is called, this process is called re-esterification. What is called? Re-esterification. So there is a formation of Tg. In the further metabolism, you understand Tg is directly stored in the fat cell, and when the body required, it takes from the blood, and there is a process of esterification and re-esterification, both occur. In esterification process, there is lipase enzyme act on it, and in re-esterification process, there is thiokinase enzymes act on it. Okay, there is thiokinase enzymes act on it. The another name of thiokinase is acyl-CoA synthetase. Okay, so there is Tg is forms, fatty acid is enter in this intestinal mucosal cell, and it form fatty acyl-CoA. Cholesterol is enter, it form cholesterol ester. Lysophospholipid, it form phospholipids. And vitamin A, D, K, because it is fat soluble vitamins, it is enter in this intestinal mucosal cell, it form again same as ADEK, and there is the formation of chylomicron. With a apolipoprotein B48. Now you understand what the meaning of this. Basically a lipoprotein. It is lipoprotein, which is majorly contain what? Right? Okay, it contains phospholipid, it contains cholesterol in there, and it contains cholesterol. Of special apoproteins. ApoB48, and this is called chylomicron, a lipoprotein molecules. Okay, so these are formed. Going to the lymphatic system, where it contains fatty acid, fatty acyl-CoA, 2 monoacyl-CoA, and lysophospholipids and vitamin A, D, E, K. So these going to the lymphatic systems and they occur. So what is happening in the blood? How these free fatty acids are move on in the blood? It is by the combination of लीवर में जाके फिर टीजी का फॉर्मेशन होगा, टीजी सिंथेसाइज होगी। पर ये फ्री फैटी एसिड आया कहां से? ये फ्री फैटी एसिड आया ईस्टरिफिकेशन प्रोसेस से। ईस्टरिफिकेशन कहां पे हुआ था? स्मॉल इंटेस्टाइन में हुआ था। ठीक है, फर्स्ट थिंग। सेकेंड थिंग, आपका ग्लिसरॉल, बिकॉज वी ऑलरेडी कन्वर्ट दिस ट्राइग्लिसराइड एज ए 2-MeG. ओके, these 2 monoacyl glycerol is directly absorbed in the blood, and it going to the, these glycerol molecule going to the liver where it can utilize, because glycerol is a substrate for gluconeogenesis. You already know. Okay? For glucose, triglyceride and phospholipids. And phospholipids, where it is utilized. Okay? You understand in the intestinal lumen, all of you? I summarize. In intestinal lumen, you easily understand. I summarize it in detail. Simply you listen what I say. Firstly, we take the lipid molecule, fat molecule in the diet in the form of triglyceride, in the form of cholesterol. Where it is present? It is present in vegetative oils. It is present in refined oils. It is present in ghee, fat. All these fat molecules we take in our diet in exogenous source of way. But majorly the percentage of fat molecule present in our diet is triglyceride. And remnant molecule is cholesterol, cholesterol ester, phospholipids. Okay? So the first process is what? First process is, it is going to the mouth where an enzyme is present. What is the name of this enzyme? Lingual lipase. How it is come? From the dorsal surface of the tongue. By which gland is present? Abner's gland. These Abner glands secreted lingual lipase, because lipase is an enzyme category which act on lipid molecules. It is lipolytic enzyme. But due to short duration of time, because bolus which we take in our diet is not retained in our mouth for a long time, this not act perfectly. These generally neutralize it. This neutralize the molecules. Now these molecule going to where? In upper duodenum part. In upper duodenum part, where there is the process called emulsification occur by the presence of bile salt. Okay, so these emulsification process and these emulsification process occur by bile salts. Okay, due to presence of emulsified by bile salt. So bile salt, what are the basically these bile salt emulsify the fat molecules and it increase the surface area of these molecules. Due to increase of the surface area, the enzyme act on properly on the right positions. Okay. Now, what is happen in the small intestines? After there is formation of 2 MAG free fatty acids by the esterification process. As you understand esterification process, what is esterification? Breakdown of ester bonds. Where ester bonds are present? These are ester bonds. Breakdown of these ester bonds. 1 and 3 molecules fatty acid chains ester bonds are break down by lipase enzymes and they form 2 monoacyl glycerol plus free fatty acid molecules. Okay? And now these going to for the next process which we call lipid absorption, where there is a formation of 2 MAG cholesterol, cholesterol ester, fatty acid, lysophospholipid by different lipases enzymes. By different lipases enzymes, and what it forms? In intestinal lumen, it is now absorbed to intestinal mucosal cells through this brush border layer. Okay. So 2 MAG is going to intestinal mucosal cell, form 2 MAG, and after resynthesize is nothing, it is reesterification process. There is a formation of TG, there is a formation of fatty acyl CoA, and there is a formation of cholesterol ester, and there is a formation of phospholipids, and they form a molecules called chylomicron. they form a molecules called chylomicron. In the next step, these molecules become transport and transport from intestinal mucosal cell into the portal blood, and from there it is going to general circulation. But question is that how these fat molecules are present in our blood generally. If we going to investigate a report which we called lipid profile, so what is cholesterol, triglyceride and LDL, HDL, VLDL, okay, all of these molecules we calculate. So that means these fat molecules, all the fat molecules are present in this way. Total cholesterol, triglyceride in the form of LDL, in the form of HDL. What is LDL? Low density lipoprotein. What is HDL? High density lipoprotein. What is VLDL? Very low density lipoprotein. Okay. So what is this? This is what is chylomicron. It is also a lipoprotein. It is also a lipoprotein, but it is not separately move on. For the movement of these molecules, first they aggregate. सब लोग इकट्ठा हो जाते हैं, ये globules बना देते हैं, which we called chylomicron. With the attachment of this special protein, we call this protein as apolipoprotein B48. Okay. In the next class, in the further metabolism, we discuss all of these things, and after then these. But it is एक कंसेप्ट दिमाग में रखना, देयर इज रीस्टेरिफिकेशन अकर इन इंटेस्टाइनल ल्यूमल सेल, ओके, एंड देयर इज आल्सो प्रेजेंट ऑफ शॉर्ट चेन फैटी एसिड एंड मीडियम चेन फैटी एसिड इन द ब्लड, which is not transported in the blood in this forms. So how can it transport it? With combined with albumin. Because it is simply fat molecules are insoluble. Fat molecules are insoluble in aqueous medium. That's why it required co-transporter. That's why it required some attachment. Okay. All of you understand it? From the last one, last line. देखिए, डाइजेशन एब्जॉर्प्शन छोटा प्रोसेस है, ज़्यादा बड़ा नहीं है, इसमें ज़्यादा दिमाग लगाने की जरूरत नहीं है. अगर हम सिंपली देखें इसको, आई कैन there is TG is present, there is cholesterol ester is present, there is phospholipid is present in our diet. Okay, the main enzyme is act on it. Which one? Lingual lipase. Lingual lipase, but it not act on these molecules because it is not retained. It just neutralize pH. If there is acidic pH of this bolus, then it just neutralize pH. Okay, then it's going for understand where what happened. It's दिखाई दे रहा है, ये एमएजी प्लस में छोड़ enter, cholesterol plus further esterification process occur. Okay, which in phospholipid it is phospholipase enzyme is act on it. Phospholipase. Okay. Now these molecules are going where this can make a molecules called mixed micelle. Plus phospholipids molecules. It form mixed micelle with okay. Bile salt having the process of emulsification. Where this 2 Mag going to the intestinal lumen, किस रूप में एब्जॉर्ब होगा, अरे यार लास्ट वन रीस्टेरिफिकेशन प्रोसेस. Re-esterification process. Cholesterol ester is present. Cholesterol, it again re-esterification process is formed. Cholesterol ester. Phospholipids are present. That is the form of medium chain fatty acid and long chain fatty acid. Now what is happening in the next step? How it is going to the blood? How it is going to absorb in the blood? Okay, so it's majorly form first one a molecules called chylomicron. Chylomicron, I will tell you, it is a lipoproteins molecules. It is a lipoprotein molecule which contain Tg, which contain cholesterol ester, which contain phospholipids, and these are all are aggregated. There is attachment of some protein. We call this protein as okay. So why there is need to form these molecules? For transportation. For transportation. Now these chylomicron molecules going to the lymphatic and into understand? Now our motto is over. Motto is what? What is the motto of digestion and absorption? Motto of digestion and absorption is to provide this fat molecule for further metabolism process. Okay? So all these are about digestion and absorption. I think you easily understand. If the question is comes, you easily write it. All of you understand it? किसने लिखा इसको? Now we studied some disorder related with that. Their first disorder is histituria. Histituria. Steatorrhea means students, if there is deficiency of lipase enzyme, okay, there is no presence of bile salt, no presence of bile salt, or any obstruction in bile, any obstruction in biliary duct, biliary duct. So what happened? This all leads to non-absorbed these triglyceride molecules and become excreted in the fecal material, then we call this condition as steatorrhea. Then we called as steatorrhea. There is any kind of deficiency of bile, deficiency of pancreatic lipase, all of this leads to non-absorbed form of lipids. They are not able to absorb it. Okay. Due to this, what happened? These lipid molecules same is excreted in the fecal, and this is called steatorrhea. Now, chyluria is the second disorder. Chyluria is present of chyle in the urine. Present of chyle in the urine. Present of chyle in the urine. Another one is pancreatitis, peptic ulcer, and cholelithiasis. Pancreatitis, cholelithiasis, and peptic ulcer. So all these disorders are related with digestion and absorption process. Okay. Why this chyle present in the urine? Due to rupture of lymphatic duct. If there is rupture of lymphatic duct, there is presence of chyle in the urine, and the condition is referred as chyluria. Now here we complete digestion and absorption process. If you have any queries from this topic, you may ask to me in the department. Okay, all of you, just read it. It is very simple. If you have any queries regarding this, you will ask to me. Thank you.
I have taken one class on receptor classification, but only few students were present, I guess 4 to 5 maximum. Okay, and what we suppose, it is a very important topic, so that your systemic physiology and systemic pathology further work gets easier, right? Okay, so may I ask you, what is receptor? What is receptor? Anyone, what is a receptor? Matlab medical receptor, not physics and all that, huh? What is a receptor? Anyone? Okay, first of all, its chemical nature. Is it a protein or carbohydrate or fat? It is a protein. Okay. Second is its location. Okay, whenever you are stuck to define a term, you ask few things like what is its chemical nature, what is its location, and what is its function. Okay. So next question is, what is its location? Okay. Okay, it may be cell surface or it may be within the cytosol, right? Okay, next is, what is its function? Okay. Okay, it will attach some ligand molecule. Okay, ligand molecule means mainly hormones or neurotransmitter or local hormones. So it will attach some hormone, and the signal sent by the hormone it will transmit into the nucleus, right? Or it will do some downstream effect, so that the final event is done. Say for example, insulin. Insulin is a ligand, right? A hormone, a ligand molecule, right? Now insulin will bind to its specific receptor. So on the cell surface, say for example adipocytes, say for example hepatocytes, say for example muscle cells. So all these cells have got a cell surface receptor which is waiting for insulin, right? So this is a hepatocyte, right? And this receptor is waiting for insulin to bind, right? This receptor is waiting for insulin to bind. It will not bind any other molecule like ACTH or TSH or T3 or T4 or steroid, whatever. This receptor is specific for insulin. It will bind only to insulin. So it is waiting for insulin. Insulin will bind to it, right? So insulin molecule will bind to this receptor, right? Okay. Now once insulin binds to the receptor, some intracellular downstream effects will happen, right? And this is a big topic, insulin binding of insulin and further downstream action. Okay, so let us assume any specific function of insulin. Okay, so insulin will reduce blood glucose, right? Insulin will reduce blood glucose by binding to hepatocytes. It will reduce blood glucose. So how to reduce blood glucose? So the processes which generate glucose, insulin will inhibit it, okay, and the processes which will consume glucose, right, insulin will accelerate it, okay. So what will happen to glycogen synthesis on the effect of insulin? It will be enhanced, okay, because glucose is being converted to glycogen. So insulin will enhance this procedure, right? Say for example gluconeogenesis, okay, gluconeogenesis, it is a procedure where non-carbohydrate substances are converted into glucose, okay. So what insulin is supposed to do with, okay, insulin will inhibit it, okay. So finally insulin will stimulate the enzymes which are required for glycogen synthesis. That means insulin will stimulate glycogenesis and it will prevent gluconeogenesis. That means the enzymes which cause gluconeogenesis will be inhibited by insulin, okay. So one of the major enzyme in glycogen synthesis is glycogen synthase, okay, glycogen synthase, right, and insulin stimulate this enzyme, right. So now question is, how insulin stimulates this enzyme glycogen synthase, okay. So here is the answer. Insulin will bind to its receptor, which is insulin receptor, right, means transcription, there is activation of transcription factor, and ultimately there is protein synthesis. Which protein? This protein, right, glycogen synthase. It is an enzyme, it is a protein, right, okay. So this is how everything is done, but there are lots of in between steps be activated, or glycogen synthase protein will be synthesized. Not like that, there are in between so many steps. Class is not to discuss all those steps, that is the mechanism of action of insulin, but in a very nutshell, upon receptor binding, once insulin binds to its receptor called insulin receptor, first event is dimerization of the receptor, okay. two receptors will dimerize, right? Receptor will dimerize, and further downstream there are multiple protein-protein interaction, various different types of protein like GRB2, MSOS. There are multiple proteins involved, and ultimately it will go into the nucleus and it will activate a transcription factor which is required for the synthesis of glycogen synthase, right? Okay, so this is how everything works. Not only insulin in case of growth hormone, in case of TSH, in case of T4, T3. So every hormone binds to its specific receptor. Okay, receptors are very specific. Now receptors are the cell surface molecule or cytosolic molecule which are protein in nature, which binds to ligand and does some downstream action, right? So this is the definition of receptor. So receptor is the connecting molecule between the ligand and the intracellular machinery, right? Okay. Now how to classify receptor? Depending on the location of the receptor, we classify receptor as cell surface receptor and intracellular receptor. So write receptor and divide it into two: cell surface receptor and intracellular receptor. Cell surface receptor and intracellular receptor. Okay, so cell surface receptor and intracellular receptor. We will talk about intracellular receptor first because there are no further subclassification, right? There are no further subclassification. So we will discuss intracellular receptor first. Okay, so intracellular receptor means the receptors are not located on the cell surface, that is fluid mosaic model, not on the fluid mosaic model, right? But on the cytosol, or it may be inside the nucleus. So intracellular receptor, and there are 4 examples for intracellular receptor. Anybody? Yes. Okay. So intracellular receptor, only 4 examples are there, only 4, and there is no 5th example. All 4 you need to remember, right? There are only 4 examples for intracellular receptor, and you need to remember it with the mnemonic STDR. Okay, STDR. S is steroid, T is T3, T4, D is vitamin D, and R is retinoids. Okay, so there are only 4 examples of intracellular receptors. These are steroid receptor superfamily, thyroid receptor, vitamin D3 receptor, and retinoids receptor, right? That means few days back you studied corticosteroid, cortisol. So cortisol is a hormone, right? So cortisol will do some action. It has many different types of action, like the permissive action, anti-inflammatory action. It will produce some anti-inflammatory cytokine and it will inhibit some inflammatory cytokine, right? If you remember cortisol. Okay, so cortisol is a corticosteroid. Okay, it has got anti-inflammatory action. Whenever there is inflammation in body, we give the patient corticosteroid. Okay, with an expectation to reduce inflammation. Say for example, an inflammatory disease like rheumatoid arthritis. Okay, so we give steroid to the patient, right? We give steroid to the patient. So cortisol, what is the major function of cortisol? Cortisol will increase the cytokines which are, it will increase the cytokines which are anti-inflammatory, like 8, right? And it will inhibit the cytokines, interleukin 8, 13, okay, 10, and it will inhibit the cytokines which are pro-inflammatory, like interleukin 2, interleukin 6, right? Okay. তাহলে কর্টিসল কি করবে, যে সাইটোকাইনস গুলো ইনফ্লামেটরি সেগুলোর সিনথেসিস কমিয়ে দেবে, আর যে সাইটোকাইনস গুলো অ্যান্টি ইনফ্লামেটরি সেগুলোর সিনথেসিস বাড়িয়ে দেবে। সো কর্টিসল উইল ইনক্রিজ দ্য সিনথেসিস অফ ইন্টারলিউকিন 8, 10, 13 and cortisol will decrease the synthesis of interleukin 2, 6. Correct? So, how to do that? Cortisol will bind to its receptor, and the receptor is located within the cell, right? Intracellular cell. Okay, steroid receptor. So, cell membrane, because cortisol is a steroid and it is soluble within the lipid bilayer, right? It is soluble in lipid bilayer, so it will penetrate. So, cortisol will penetrate the cell membrane and enter into the cell, and it will bind to its specific receptor, steroid receptor element, right? Steroid receptor element, and steroid receptor element plus steroid, this complex enters into the nucleus and it will activate some transcription factors and it will deactivate some transcription factors. It will activate the transcription factors which are required for synthesis of IL, synthesis of interleukin 2 and 6, right? So, this is how steroid works in a very nutshell, but there are multiple steps. I jumped few steps, right, because this is not a class on mechanism of action of steroid, right? Okay, we are on classification of steroid, right? So, similarly, T3, T4, they are protein in nature, they are not steroid, they are not soluble in lipid bilayer, but still they are entering into the cell. How? Because of a carrier molecule, right? Because of a carrier molecule, and the process is called facilitated diffusion. You know what is facilitated diffusion, right? Okay. Similarly, vitamin D3 retinoids, they are also diffusible through the cell membrane, enter into the nucleus and binds to the intracellular receptor, right? Okay. So, intracellular receptor is over. You classify receptor as cell surface receptor and intracellular receptor. Under intracellular receptor, you have 4 examples: STDR, steroid, vitamin D3, T3, T4 and retinoids. Now, we will switch over to cell surface receptor, the receptors which are located on the cell membrane, right? We call it cell surface receptor. Okay. Now, the first classification under cell surface receptor is the first classification under cell surface receptor is ion channel receptor. Okay, ion channel receptor classification under cell surface. Okay, ion channel receptor. Okay, that means you have a topic on ion channels in general physiology, you have another topic in physiology, that is receptor. So, this is ion channel receptor. So, this is ion channel plus receptor. So, the same molecule which is acting as an ion channel, it is also acting as a receptor. So, we call it ion channel receptor. Okay, same molecule or same protein is behaving as ion channel and as well as a receptor, right? And under ion channel receptor, you have for you just remember three okay. Pentameric cis loop superfamily, that means cysteine residues are cis loop because cysteine residues are there, right? Pentameric cis loop superfamily, then glutamate receptor and TRP. Okay, TRP channels. So, first pentameric cis loop superfamily. Pentameric cis loop superfamily examples are GABA, glycine, acetylcholine, histamine, serotonin, right? So, GABA, glycine, acetylcholine, nicotinic, histamine, and serotonin. Right? Okay, you need to classify and you need to remember the examples. Okay, your examiner is asking you nicotinic acetylcholine receptor. What kind of receptor is this? Okay, so nicotinic acetylcholine receptor belongs to pentameric cis loop superfamily, which is an ion channel receptor. This is your answer. Okay, what kind of receptor is GABA? GABA receptor. You know GABA, gamma aminobutyric acid, right? So it is an inhibitory. It is an inhibitory neurotransmitter. It will reduce the excitability of a neuron. Okay. Okay. So pentameric cis loop superfamily. Pentameric means it has 5 subunits. Pentameric means it has 5 subunits. So it looks like this. So this is lipid. Okay, so this is how 5 subunits are arranged in a flower fashion, right? This is how 5 subunits are arranged. Say for example, this is GABA receptor, gamma aminobutyric acid receptor. When do we use GABA? Any medical application of GABA? I told GABA is a neurotransmitter which reduce neuronal excitability. Okay, GABA is a neurotransmitter which reduce neuronal excitability. That means neurons will be less excitable, right? Less excitable. That means action potential, the chances of generation of action potential will be less, right? Okay, so neurons will be inhibited. If we inject GABA to a patient, okay, the patient will be drowsy. There will be less neuronal excitation, right? And the opposite thing, if we inject glutamate to the patient, which will increase neuronal excitability, right? Okay, so when do we use GABA? In case of epilepsy, seizure, convulsion, right? When neuronal excitability is high. Okay, so we will use any medication which is GABAergic, which mimics the action of GABA, right? Like gabapentin, like pregabalin. These are medications which we use for convulsions, seizure, right? When neuronal excitability is high. So how does GABA work? Okay, how does GABA work? GABA will bind to this pentameric cis loop superfamily receptor. So there are multiple subunits. This is alpha subunit. Okay, so GABA will bind. So this is GABA. Located on the alpha subunit, right? So this GABA will bind to this specific receptor on the alpha subunit, right? Once GABA binds to it, this pentameric substance, it rearrange. There is a rearrangement. Okay, there is a rearrangement. So if we do a cross section here, if we do a cross section, right? If we do a cross section and there is a pore, right? There is a pore through which chloride enters into the cell. So suppose this is a neuron. This is the cell membrane of a neuron, right? This is the cell membrane of a neuron, and on the cell membrane, this pentameric superfamily receptor is located. So it is a receptor because it is binding to GABA, and it is also an ion channel because it can pass chloride inside, right? So once GABA binds to it, this alpha subunit, there is a rearrangement, right? There is a whirling motion, right? And chloride will enter into this cell, right? So chloride will enter into this cell, and you know chloride is a negative ion, and when chloride enters into the neuron, what will happen? The membrane potential will be towards negative, right? So neuronal excitability will be less. Okay. So this is how GABA works, or any medication which mimics the function of GABA, right? Like gabapentin, like pregabalin. So these are substances which mimics the action of GABA, right? And these are the drugs we use in cases of neuronal hyperexcitability, like convulsion, seizure, and any epileptic disorder, right? And also in case of neuropathic pain. Okay. So pentameric cis loop superfamily examples are GABA, glycine, acetylcholine, nicotinic, histamine, serotonin. All you don't need to explain, only GABA or say for acetylcholine you can explain, right? Okay, next is glutamate receptor. Glutamate receptor we will study later on in nervous system. Glutamate is a neurotransmitter which increases neuronal excitability, just opposite to GABA. GABA reduces neuronal excitability, and glutamate glycine, they increase neuronal excitability, right? Okay. There are different types of glutamate receptor like NMDA receptor and K-NAT receptor, right? Okay, you will study all these things in nervous system. Next is TRP. TRP is transient receptor potential. Transient receptor potential. Okay, TRP channel, transient receptor potential channel. It is basically a few years back, someone got, I don't remember the name of the scientist, someone got Nobel Prize for discovering TRP channels. Okay, a few years back. Okay, so TRP is a non-specific cation channel, right? TRP or transient receptor potential vanilloid is a non-specific cation channel. And have you heard of thermoreceptor? Thermoreceptor. On our skin, we have some channels at the nerve endings. These are called TRP channels. Okay. With these channels, you sense cold or warmth, right? So there are different classification of TRPs. According to the temperature, right? They are mainly potassium sensitive channels, TRP M, TRP M1, M2, M8 ऐसे करके classification है, but you don't need to know right now. Okay, these are all under nervous system in sensory system. Okay, so TRP channels are involved in temperature sensation. Okay, and these are non-specific channel, but the most predominant ion which passes through the TRP channel is potassium. Okay, ठीक. Now ion channel receptor is over, which is the first classification under cell surface receptor, right? First classification. Now the very well, I guess, that is G protein coupled receptor. G protein coupled receptor. What is G protein coupled receptor? So it is a receptor which is connected to a heterotrimeric protein called G protein. It has got 3 subunits, alpha, beta and gamma. So what is the arrangement? So this is the cell membrane. This is the cell membrane, and GPCR, G protein coupled receptor, is a serpentine receptor. It has 7 transmembrane domain. So it will cross the cell membrane 7 times. Okay, 1, 2, 3, 4, 5, 6 and 7. So this is GPCR. It is a protein, it is a polypeptide chain, and the chain passes the cell membrane 7 times. Okay, so it is GPCR, G protein coupled receptor. Why G protein coupled? This is not G protein. This is G protein coupled receptor. Okay, and attached to this receptor is a protein which has got 3 subunit, alpha, beta and gamma. So this is the total arrangement. This is GPCR and this is G protein. Okay, this is GPCR and this is G protein, and this receptor is called G protein coupled receptor, as because it is coupled to G protein, it is attached to G protein, right? Okay, so most of the hormones you study, like ACTH, like parathormone, right, like TSH, everything, adrenaline, noradrenaline, epinephrine, norepinephrine, all these hormones bind to GPCR. Most of the hormones, gastrin, cholecystokinin, in GI hormone, right? So all these hormones bind to GPCR. Okay. And further action, do you know further action? What will happen once, say for example, epinephrine. Say for example, epinephrine. So epinephrine is binding to GPCR. Then what will happen? Okay, alpha subunit will separate from beta gamma, right? Now next, what will happen? Next. Yes. One enzyme is formed. What is that enzyme? Adenylyl cyclase. Then adenylyl cyclase will convert ATP to cyclic AMP. Cyclic AMP, right? ATP to cyclic AMP. So there will be formation of cyclic AMP, right? There will be formation of cyclic AMP. And finally, there will be activation of protein kinase A. Okay, all these steps you need to remember, because G protein coupled receptor action is a separate question, right? Right now we are dealing only with the classification. We are not going every detail into the classification, right? But G protein coupled receptor is a separate topic, right? Separately you need to prepare this for answering, right? Okay. So there will be formation of cyclic AMP and ultimately protein kinase A, and it will phosphorylate some of the enzymes, right? Okay. So classification is this: coupled receptor. There are different types of function. Okay. One function is alpha mediated action. One function is alpha mediated action. Another function. Okay, once the ligand molecule binds to GPCR, there is separation of beta gamma and alpha. Okay, so beta gamma alag ho gaya and alpha alag ho gaya, right? Now beta gamma has got some action and alpha has got some action. Okay, whatever you were telling is the alpha action, cyclic AMP, protein kinase A, these are alpha action, right? So alpha mediated action, beta gamma mediated action. Beta gamma mediated action happens in M2 receptor, acetylcholine M2 receptor, muscarinic, okay, which increases potassium conductivity, right? Okay, and alpha mediated action, it is of three types. One is AMP pathway and another is arachidonic acid pathway, okay. And the question will, what you face in examination is the cyclic AMP pathway, which is the most common, right? Cyclic AMP pathway is the most common, because most of the hormones like parathormone, TSH, they act through this cyclic AMP pathway, right? And there are two other pathways like cyclic GMP pathway and arachidonic acid pathway. Arachidonic acid pathway example is CCK, cholecystokinin, okay, and beta gamma through M2 receptor acetylcholine, located in heart, right? Potassium channel in heart. Okay. So I am not entering into every detail of those classification. So ion channel receptor classification is done. Pentameric cis loop superfamily, TRP and pentameric cis loop superfamily, TRP আরেকটা কি বললাম? Glutamate receptor. So ion channel receptor, right? Under GPCR we have alpha mediated action and beta gamma mediated action. Under beta gamma, example is acetylcholine through M2 receptor, right? And alpha mediated action, we have three pathways. One is cyclic AMP pathway, cyclic GMP pathway and arachidonic acid pathway. Cyclic GMP pathway happens in eyes, okay? You will study in nervous system, okay. So ion channel receptor, G protein coupled receptor. Now third classification and the major and very important classification. This is catalytic receptor. It is also called enzyme. Catalytic receptor or enzyme linked receptor. Okay. In first classification under cell surface receptor, that is ion channel receptor, we told that the same protein is behaving as ion channel and as receptor. Same protein. Here in C, category C, the same protein, it is behaving as the enzyme as well as the receptor. Okay. So this is why it is called enzyme linked receptor. Okay. Enzyme linked receptor. Enzyme linked receptor, there are multiple classification, and please remember all those things, right? Okay. Under enzyme linked receptor, first classification is receptor serine threonine kinase. Number 2 is receptor guanylyl cyclase. Receptor tyrosine kinase. Number 4 is receptor tyrosine kinase associated. So there are 4 subclassification under catalytic receptor or enzyme linked receptor. Okay, jeta receptor setai enzyme, same protein. Okay, same protein, cell surface protein, it is receptor as well as enzyme. So first classification is receptor serine threonine kinase. An example is only one growth factor, TGF. Superfamily. Under it, we have many hormones. Have you heard the name of AMH? Anti-Mullerian hormone. We will study in reproductive system. Anti-Mullerian hormone, which is responsible for Mullerian, yes, dysgenesis, right? So anti-Mullerian hormone. So Mullerian duct, the derivative of Mullerian duct. Do you know what is the derivative of Mullerian duct and Wolffian duct? Mullerian duct will develop into female structures. Okay, Mullerian duct will develop into in anatomy also you will study. Mullerian duct will develop into female structure like the uterus, the fallopian tube, upper 2/3 of vagina, right? Mullerian duct. And Wolffian duct will give rise to vas deferens, right? So Mullerian duct will give rise to female structure and Wolffian duct will give rise to male structures, right? And anti-Mullerian hormone in male, anti-Mullerian hormone, it causes dysgenesis of the structure which is coming from Mullerian duct. Anti-Mullerian hormone, right? Okay. So anti-Mullerian hormone, it will walk through. It is under AMH, anti-Mullerian hormone, right? So it acts through receptor serine threonine kinase. I told it is enzyme linked receptor. That means the name of the receptor will be the name of the enzyme. So this is serine threonine kinase. So it is a type of kinase. Kinase means which causes phosphorylation. Okay, kinase is a kind of enzyme which causes phosphorylation. It adds phosphate moiety, right? So it causes phosphorylation of serine threonine, right? So this is why the name of the enzyme is serine threonine kinase. Okay. And one of the such receptor is AMH receptor, anti-Mullerian hormone. So anti-Mullerian hormone কিভাবে কাজ করে এইভাবে it binds to receptor serine threonine kinase, right, on the cell surface, and further তারপরে downstream action আছে, right? Okay. Now next is receptor guanylyl cyclase. Receptor guanylyl cyclase, and the example is, yes, very nice, AP. Atrial natriuretic peptide. Atrial natriuretic peptide. So atrial natriuretic peptide is a hormone which is released from atria whenever there is stretching. Okay. I had talked about aldosterone escape, if you remember. Aldosterone escape. So what was happening in aldosterone escape? There is increased aldosterone synthesis, there is increased sodium and water retention. As a result, there is volume overload and atria is stretched, right? And once atria is stretched, atrial myocytes will release one hormone called atrial natriuretic peptide, and they will release sodium in urine, right? So how atrial natriuretic peptide is to release sodium in urine, and action is there at the collecting tubule, right? So how does atrial natriuretic peptide perform its action? Through binding to receptor guanylyl cyclase, right? Okay. So from the beginning, remember. Okay, let me tell you this third classification. So third classification is RTK. RTK means receptor, very important, very important. Okay, throughout your career, right? Receptor tyrosine kinase. Receptor tyrosine kinase, and the example is insulin. Okay, the major hormone insulin, right? So under RTK, receptor tyrosine kinase. What I told at the very beginning, right? Now let me tell you what is the difference between many times students do these mistakes. The thing is, the question is, read the question carefully, whether they are asking for action or mechanism of action. So there is a difference. What is action of insulin and what is mechanism of action of insulin? Okay. So answer is, what is action of insulin? You write, it prevents gluconeogenesis. Okay. It stimulates glycogenesis. It inhibits glycogenolysis. This is action of insulin. And what is mechanism of action of insulin? Insulin binds to receptor tyrosine kinase, right? Then there is dimerization of receptor. Then there is all the extra proteins which are required for the downstream pathway like GRB2, MSOS, and finally the transcription factor activation or transcription factor suppression, right? So this is mechanism of action insulin. Mechanism of action means at the cellular level, at very microscopic level, right? And action means the gross action. What insulin is doing to carbohydrate metabolism, what insulin is doing to protein metabolism, what insulin is doing to fat metabolism, and any other action, right? So this is action of insulin. And mechanism of action means what to what receptor insulin binds, and further what is happening inside the cell at very microscopic level, right? At the molecular level, what is happening? This is mechanism of action. Okay, mechanism of action means at the molecular level, biotechnology level, right? Okay. So what are other actions, what are other examples under receptor tyrosine kinase? IGF-1. IGF-1. What is IGF-1? It is a growth factor. It is a growth factor, and all the growth factors except TGF, because TGF is already covered under serine threonine kinase, transdermal growth factor, right? It is already covered under serine threonine kinase. So under receptor tyrosine kinase, we have insulin, we have IGF-1, we have PDGF, we have NGF, we have FGF, we have VDGF, right? Everything else, any growth factor. Okay, so now PDGF, platelet derived growth factor, right? So all these growth factors, they bind to receptor tyrosine kinase. Okay. So এখানে একটা খুবই মানে ইম্পর্টেন্ট জিনিস লক্ষ্য করার মতো, that is under receptor tyrosine kinase all are growth factors, and insulin, it is also a growth factor, right? I told in previous classes that insulin is basically a growth factor. Okay, whenever question comes as action of insulin, you write effect on fat metabolism, effect on carbohydrate metabolism, effect on protein metabolism, but you skip the action of insulin on growth. So insulin is basically a growth factor. So from the molecular level, it binds to tyrosine kinase receptor. So whatever hormone binds to tyrosine kinase receptor, it is a growth factor. It must be a growth factor, and insulin also a growth factor, right? Any hormone that binds to tyrosine kinase receptor, it must be a growth factor, and you see insulin binds to tyrosine kinase receptor. So insulin is a growth factor. So what is the effect of growth on insulin? You know? Yes. You know the growth factor in human is growth hormone, right? The growth hormone GH, secreted from anterior pituitary, everybody knows. But in intrauterine life, before birth, it is not growth hormone. Yes, it is IGF-1. The major hormone which causes fetal growth is IGF-1, and along with IGF-1, two other hormones that causes fetal growth, one is insulin and another is thyroxine, right? So what hormone is causing growth in fetus? If you answer growth hormone, absolutely wrong. No, growth hormone. Okay, growth hormone has got absolutely no role in intrauterine life. Fetal growth is done by IGF-1, insulin like growth factor 1, number 1, number 2 insulin, number 3 thyroxine. These three hormones are causing fetal growth. And even at the age of 1 year, even up to at the age of 1 year, IGF-1 is causing growth of the baby, right? 1 year age onwards, growth hormone takes over its action from IGF-1, right? Okay, so এক বছর বয়স পর্যন্ত IGF-1 ই মেন গ্রোথ করে, and in intrauterine life, it is IGF-1, it is thyroxine, and it is insulin. Okay, and one very important clinical finding is if you see a diabetic mother, Okay, if you see a diabetic mother, the pregnant mother is diabetic. The pregnant mother is diabetic. What will happen to the baby? What will happen to the baby? It is called macrosomia. Macro means large. Somia means body. So the baby will be large. Okay, and you can't do a normal delivery. And in case of diabetic mother, as the baby is huge, right? As the baby is huge, maybe 4 kg or 4.5 kg. So normal birth weight baby, 2.5 kg, right? But in case of diabetic mother, if the diabetes is not controlled in the mother, what will happen? The baby will be large. We call it macrosomia. Okay, and the birth weight of the baby will be বাচ্চার ওজন হবে 4.5 kg, 5 kg, okay, 4 kg এরকম বাচ্চার ওজন হবে, right? So why it is happening to the baby? Why there is overgrowth of the baby? Because of insulin. Because mother is diabetic, right? Mother is diabetic. So mother has increased glucose in mother's blood, right? And this glucose will diffuse through the placenta. Glucose can easily enter into the placenta, right? Glucose can easily cross the placenta. So glucose is not protein, it is soluble, right? It will enter through the placenta and it will enter into the fetal blood. Okay, so maternal hyperglycemia will cause fetal hyperglycemia. বাচ্চার বডিতে গ্লুকোজ বেশি হয়ে যাবে, right? ফিটাসের গ্লুকোজ বেশি হয়ে যাবে, right? So fetal hyperglycemia will stimulate fetal insulin secretion, right? Fetal hyperglycemia will stimulate fetal insulin secretion, right? Now hyperinsulinemia in fetus, it will cause increased growth of the fetus. Okay, so insulin is primarily a growth factor. Before there is any effect on metabolism, effect on carbohydrate, fat or protein, insulin is basically a growth factor, right? So from very molecular level, you can identify that insulin is a growth factor because it binds to tyrosine kinase receptor, right? Okay. Now receptor tyrosine kinase associated, another classification under enzyme linked receptor. The fourth classification is RTKa, which is very similar to RTK, but it is RTKa, receptor tyrosine kinase associated. That means the receptor is exactly not tyrosine kinase, but it is attached to a protein which is tyrosine kinase. And in case of insulin receptor, the receptor itself is tyrosine kinase, right? Receptor itself is tyrosine kinase, and here in the fourth classification, the receptor is not tyrosine kinase, but it is attached to a protein which is tyrosine kinase. So receptor tyrosine kinase associated, and the example is growth hormone. Okay, you must remember growth hormone. Okay, so an example of growth hormone pathway is JAK-STAT pathway. Very nice, you are studying. Okay, so example is JAK-STAT pathway. So what are other examples? What are other examples of RTK? One is growth hormone receptor, another is erythropoietin. Yes, erythropoietin, growth hormone, erythropoietin, leptin. Leptin, you will study leptin. Do you know what is leptin? Separated from fat cells. Yes, very nice. It is a hormone which is secreted from adipocytes, and it controls hypothalamic feeding and satiety, right? It controls hypothalamic feeding and satiety, right? So growth hormone, erythropoietin, leptin.
Everyone, so today our topic is the lumbar vertebra. Okay, so before going to the lumbar vertebra, you have to know what are the basic characteristics of a vertebra. Okay, how many vertebra we are having? Total 33, right? Among them we are having the cervical is 7, then next one is thoracic is 12, then lumbar 5, sacral 5, and we are having coccyx 1. So how many spinal nerve we are having? Total 31 pairs. So how many there is? Cervical are how many? 8. Thoracic are 12. Lumbar is 5. Sacral how many? 5. Sacral? What about the sacral? Total 5. Okay, so how many? 31 pairs. Okay, so write down what are the characteristics of vertebra. What are the characteristics of vertebra? Write it down. So basically vertebra is having one, this is the vertebral body. See everyone, this is the vertebral body, and backwards we are having the arch. Okay, this is also known as neural arch. So how does the vertebra develops? How does the vertebra develops? In which intrauterine life? Tell me the time. Between 8 to 16 weeks. Okay, or you could write 9 to 16 weeks. Okay, so that is the when this body for the ossification develops. Okay, so about the lumbar vertebra, they are divided into typical and atypical vertebra. Okay, write it down. The lumbar vertebrae are divided into typical and atypical lumbar vertebra. Okay, so among the L1 to L5, which one is atypical? L5. L5 is the atypical lumbar vertebra. Okay, so now we will write what are the characteristics, which are the characteristics of typical lumbar vertebra. Okay, number 1, write it down. You could see how the body looks like. It's much larger than the other vertebra. Okay, so write it down. The body is massive. The body is massive and reniform in shape, reniform or kidneyform in shape. This is the first characteristic feature. Second, if you go backwards, you will get one foramen. So that is known as, what is this foramen is called? Vertebral foramen or intervertebral foramen? It is vertebral foramen. So there is again existence of intervertebral foramen. We will come later on. Okay, so this is the vertebral foramen. So how you could see what is the nature of this vertebral foramen? It is triangular in shape. Okay, write it down. It is triangular in shape. So which vertebra you have studied? Up to now you have studied the thoracic vertebra. So how does the thoracic vertebra look like? The vertebral foramen and the body, could you remember? Body is the circular small, okay, and vertebral foramen is heart shape. Okay, vertebral foramen is heart shape. Okay, so this is about the body and the vertebral foramen. Okay, next we will write what about the vertebral arch. Write it down, vertebral arch. So now tell me, vertebral arch are having how many structure? Consist about, this whole is the vertebral arch. So it consists of how many processes? So at first two bony facet. Kiki, first one is pedicle. Number 1 is pedicle. So pedicle is connecting between the vertebral body with the neural arch. Okay, and which one is the lamina? This is the lamina. Okay, so lamina is connecting between the spinous process with the transverse process. Okay, so write it down. Vertebral arch consists of pedicle and lamina. Pedicle and lamina. Okay, and how many processes it has got? 2 superior articular facet, 2 inferior articular facet, 2 transverse process and 1 spinous process. So write it down, total 7. Okay, 7 processes. 7 processes. 2 superior articular process, 2 superior articular process, 2 inferior articular process, 2 transverse process and 1 spinous process. Okay, now about the general structure of the body of the vertebra. Which structure are present? What is the attachment of the body of the vertebra? Which structure is attached over here? Ki bole? Nucleus pulposus, and outside is annulus fibrosus. Okay, so just write it down. The body of the vertebra in center there is attachment of nucleus pulposus, nucleus pulposus. Okay, and the periphery there is attachment of annulus fibrosus. Okay. So what are the other things that are attached? See, if you see the vertebra, this is the anterior part, this is the posterior part, this is the superior part, this is the inferior part. So in the anterior part, which thing is attached on the center? Very good, anterior longitudinal ligament. Okay, just write it down. Anterior to the vertebral body, anterior to the vertebral body, on the anterior surface, there is attachment of anterior longitudinal ligament. So simultaneously, if you see backwards, okay, if you go backwards, posterior to the vertebral body, you are having two veins. These are known as basivertebral vein. Okay, so write it down. Posterior to the vertebral body, so that is the posterior surface of the body of vertebra, having the basivertebral vein. Okay, basivertebral vein, BASI, basivertebral veins. So you could find this foramen. Okay, see, backwards we are having the foramen. And which are the other thing that are found? Posterior longitudinal ligament. There is the attachment of posterior longitudinal ligament. Okay, and now coming to the vertebral foramen, which things are passing to the vertebral foramen? Whenever you are saying spinal cord, tell spinal cord along with meninges. Okay, so write it down. Vertebral foramen is transmitting spinal cord along with the meninges. Okay, আর কি করবে? Write it down. Membrana tectoria. And anterior cruciate ligament. এখানেও একটা cruciate ligament পাওয়া যায়. Okay, anterior cruciate ligament and membrana tectoria. So these three things you have to remember, that is passing through this hair. And what is the extension of spinal cord? In case of adult, there are two cases. In case of adult, in case of newborns. Okay, so for adult, at the lower border of L1. So write it down. In case of adult, এটা কিন্তু বারবার MCQ আছে. Okay, what is the termination of spinal cord occurs in case of adult is at the lower border of L1. Yeah, it is crossing the transpyroric line. Okay, so which part of spinal cord? Tell me, what is the length of spinal cord? Length of spinal cord is 45 centimeter, right? So that part is known as conus medullaris. Okay, কোন পার্টটা পাওয়া যাবে spinal cord এ L1 এ? Conus medullaris. Write it down. At L1 there is a presence of conus medullaris. So what about the other lumbar vertebra? L1 এর lower border এ conus medullaris হয়ে spinal cord finished. Okay, what about the lower border, lower lumbar vertebra? That means L2 to L5. Which thing are there? That is the bunch of nerves. So that is known as cauda equina. Okay, so write it down. Cauda equina. It is looking like a horse tail. Okay, it is looking like a horse tail. সেজন্য এটার নাম কি? Cauda equina. EQINA. equina. ঠিক আছে? So it is looking like a horse tail. Okay, so that will extend কত থেকে কত হচ্ছে তাহলে? L2 to, write it down, L2 to the L5. Okay, L2 to the L5. And in case of newborn, where it terminates? at the level of lower border of L3. Okay. So in case of newborn, spinal cord terminates at the lower border of L3, and this is also the site for किससे side eta? This is also the site for lumbar puncture. Okay, you have to be ensured that there is no damage to the nerve. Okay, so that's why you are piercing at that location. Okay, so this is the most clinical importance thing about lumbar vertebra. Then next one we will discuss. So vertebral foramen is over. Whatever I am saying, this is for typical lumbar vertebra. These are the characteristic of typical lumbar vertebra. So next one we will discuss about the vertebral arch. Okay, so number one will come about the superior articular process. Write it down, superior articular process. So which are the characteristic? So if you see the other vertebra, how the superior articular process look like? Have you seen? This is which vertebra? Could you tell? This is thoracic. So if you see the superior articular facet, see how it is present. It is just projecting upwards. So if you see the lumbar, what is happening? See, this is the superior articular process. How you are identifying? Write it down. It is concave. Okay, write it down. This is the characteristic, concave. So appearance is concave and it is directed medially. Okay, it is directed facing medially. Okay, you could see it is directed medially. Okay, then about the inferior articular process. Inferior articular process. So just opposite, see over here, it is convex. Okay, so inferior articular process is convex and projected laterally, just opposite. Okay, it is convex and it is projected laterally. Okay, so this is the superior articular process and inferior articular process. Okay, so next one is the transverse process. So write it down, transverse process. Okay, one thing, put a star mark, one thing we will get, that is known as mammillary process. Okay, in the lumbar vertebra we will get mammillary process. What is that? So if you see, this is the superior articular process, right? It is concave. So if you go to the posterior border of the superior articular process, there you will get one small minute projection, okay, which is faces downwards. So this is the mammillary process, very much important. This is the characteristic feature of lumbar vertebra. So write it down, mammillary process is found on the posterior border of superior articular process. Okay, now coming to the transverse process. So if you see the transverse process, what is the appearance? See the transverse process, is it same like others? So in the transverse process of thoracic you have studied. So what are the feature? Transverse process having costal facet for the rib, but here you are getting nothing. Okay, it is more elongated. Why? Give numerous attachment. Okay, so number one, if you see the root of transverse process, see the root of transverse process, there is one projection. You could see, তাই তো, যেখানে রুটটা যেখানে শুরু হচ্ছে, so there you are getting one elevation. This is known as accessory process. Write it down, accessory process. So accessory process is found at the root of transverse process. At the root of transverse process. See, these are the accessory process যেখানে শুরু হচ্ছে, ঠিক আছে? So this is the accessory process. Don't confuse, mammillary process কোথায় আছে? Posterior surface of the superior articular facet, and this one is the at the root of transverse process. Now see the transverse process more closely. If you see again on the anterior surface there is one ridge. Okay, if you go laterally, Here you are getting one ridge. This is known as anterior ridge of transverse process. Write it down. So on the lateral aspect, there is parallel, there is one ridge present on the transverse process, that is known as anterior ridge. Okay, that is known as anterior ridge. So this is about the transverse process. So you have to mention the mammillary process and you have to mention the accessory process and anterior ridge that is present on the transverse process. Okay, now we are coming to the spinous process. Okay, so write it down. What are the characteristics of spinous process? You could see, is it projected? What is the shape of spinous process? It is quadrangular in shape. Okay, so write it down. It is quadrangular in shape. It is broad and directed straight. Okay, it is not downwards. See the other spinous process kirokom dekhechi is downwards, tai to, but here see it is just projected straight. Okay, or you could write projected backwards. It is quadrangular in shape and projected backwards and horizontally Okay, now we will come across one by one attachment. Okay, already we have discussed the body. Okay, now we are coming to the superior articular facet and the mammillary process. So which thing is attached to the mammillary process? So for that you have to know one very important thing. We will study on the back, that is known as thoracolumbar fossa. Okay, so write it down, thoracolumbar fossa. So what is the thoracolumbar fossa? So this is one of the deep fossa. It one of the deep fossa that encloses the muscle on the posterior abdominal wall. The muscle on the posterior abdominal wall. Now tell me which are the four posterior abdominal wall muscle? Ki bol? Sobar age diaphragm. Okay, then next. Psoas major, right? Psoas major, then iliacus hobe na. Quadratus lumborum, then another one is transversus abdominis. So these are the four muscle present on the posterior abdominal wall. So which thing this thoracolumbar fossa is doing? It is just closing this particular muscle. Okay. So what is the attachment? You write number one. First one, there are three lamella. Write it down. There are three lamella. Lamella means the fibers from where this fossa is coming. Okay. So there are three lamella of the thoracolumbar fossa. There are three lamina of the thoracolumbar fossa. They are anterior, middle and the posterior. Anterior, middle and the posterior. Okay. Now most important muscle over the lumbar vertebra, you know, that is ki muscle ache ota? That is the psoas major. Okay. And psoas majors are coming directly or indirectly? Is it attached? Where it is attached? Which part of lumbar vertebra? Just side of the body of lumbar vertebra. Okay. So one by one we will discuss. Write it down. At first the diaphragm. Okay, diaphragm, there is medial and lateral crura of diaphragm. You could remember the diaphragm in the crura in the diaphragm, right? So there are two crura, medial and lateral. What is the extension?
Medial L1 to L3, lateral L1 to L2.
Very good. Okay. So medial ta kothay thakbe? L1, L2, L3. So write it down. Medial extension L1, the body of the L1, L2 and L3. L1, L2 and L3. And the lateral extension was L1 and L2, only two, L1 and L2. And there are simultaneously another two structure that is known as medial and lateral arcuate ligament. Okay, so medial and lateral arcuate ligament কোথায় attach থাকবে? Only to the body of L1. Okay, write it down. The medial and lateral arcuate ligament of diaphragm, if you could remember the picture of diaphragm, there are two ligament, medial and lateral arcuate ligament. So it is attached to the body of the L1. Okay, it is attached to the body of the L1. Okay, then next muscle we will come across. So diaphragm is over. So first muscle you are getting diaphragm. কি পেলাম? একটা হচ্ছে medial and lateral arcuate ligament and another one is the medial and lateral reflection of the crura, that is known as crura of the diaphragm. Okay, next one is the psoas major. Okay, so write it down. Psoas major is the next muscle you will get. Psoas major. So it take tendinous origin. It take tendinous origin from the body of L1 to L5, from the body of L1 to L5. Okay, so which structure is present between the psoas major, tendinous origin and the body? That is very much important. That is nothing but lumbar artery. বুঝতে পারলি? দুটো স্ট্রাকচারের মধ্যে কি আছে? which structure is intervening? That is the lumbar artery. Write it down. Lumbar artery intervenes between the body of lumbar vertebra, and the origin of psoas major, Okay, now see here, psoas major is coming from the body of the lumbar vertebra, so it should be also enclosed by some deep fossa, that is known as psoas fossa. Okay, so the psoas major encloses by one deep fossa which is known as psoas fossa. Okay, now এখানে হয়ে গেল psoas fossa. So diaphragmটা কোথায় গেল? শুধু L1, then পুরোটা হলো L1 to L5, পুরো psoas major. Next muscle we are having কি পাবো? Quadratus lumborum, right? Where it is present? It is present on the transverse process. Okay, so write it down. Next muscle attached to the transverse process is the quadratus lumborum. It is the quadratus lumborum. And now see over here, there is two attachment. I told three lamina, তিনটে lamina of thoracolumbar fossa. So number one attachment which is known as anterior attachment, সেটা কোথায় থাকবে? Anterior ridge. Okay, middle টা কোথায় থাকবে? This tip of the transverse process. Okay, and posterior lamina কোথায় থাকবে? Spinous process. বুঝতে পারলি? So write it down. Three attachment of thoracolumbar fossa. Anterior lamina is attached to the anterior ridge of transverse process. Okay, middle lamina is attached to the tip of transverse process. Middle lamina, এই তিনটে lamina কিন্তু thoracolumbar fossa, ঠিক আছে? Middle lamina is attached to the tip of the transverse process. Okay, and the posterior lamina is attached to this tip of the, not tip, see tip would be attached, there would be one ligament, do you know? Tip of the spinous process, there is one ligament which is running throughout the spinal cord, and it would be attached where? To the occipital protuberance. সেটাকে কি বলে? ligamentum nuchae. কি বলে সেটাকে? ligamentum nuchae. পুরো spinous process দিয়ে যাচ্ছে, it would be attached to the occipital protuberance. বুঝতে পারলি? So that is found on the tip. So just beside the tip there is an attachment of posterior lamina of thoracolumbar fossa. So write it down. just beside the tip of spinous process, there is attachment of posterior lamina of thoracolumbar fossa. Okay, so you already know the psoas major is closed, right? So psoas fossa diye closed. Then here you are getting what? Quadratus lumborum. So it is enclosed by anterior and middle lamina of thoracolumbar fossa. বুঝতে পারলি? এখান থেকে বের হচ্ছে anterior lamina, এখান থেকে বের হচ্ছে middle lamina. So both are enclosing quadratus lumborum. So write it down. Quadratus lumborum is enclosed by thoracolumbar fossa, কিন্তু ভীষণ ইম্পর্টেন্ট, আমরা আবার পড়বো। Okay, it may comes as short note. Okay, along with diagram. So quadratus lumborum is enclosed by both anterior lamina and middle lamina of thoracolumbar fossa. Okay, then what about the posterior lamina? Now see here, there is two deep muscle of the neck. Okay, so posterior lamina of thoracolumbar fossa, write it down. Posterior lamina of thoracolumbar fossa encloses two deep muscle of the neck. Encloses the two deep muscle of the neck. একটার নাম হচ্ছে multifidus. Okay, one is multifidus. FIDUS, multifidus, and another one is erector spinae, and another one is erector spinae. So these two is present where? Here. Okay, and additionally here on the lamina there is attachment of lamina te ki thake, write it down. In lamina there is attachment of বল এটা কোন লিগামেন্ট? এখানে আমি বলে দিলাম লিগামেন্টাম নিউকি থ্রুআউট, ঠিক আছে? তা ল্যামিনা মিন্স where between the transverse process and the spinous process, এই যে বনি পার্টটা এটাকে কি বলছি? ল্যামিনা। তো ল্যামিনাতে which thing is attached, which ligament? অলরেডি তো thoracic vertebrae বলেছি। So what is that? Ligamentum flavum. Okay, lamina there is attachment of ligamentum flavum. Okay, so this is the attachment of transverse process. Okay, now we will come across the attachment of spinous process. Okay, so write it down. Attachment of spinous process. Acha, just see the tip of spinous process. Already I told, it is also known as supraspinous ligament or ligamentum nuchae. Arekta naam ki? Supraspinous ligament. Okay, so there is attachment of ligamentum nuchae, and another name is supraspinous ligament. এই জায়গাটায় থাকে, ঠিক আছে? And what is the main function of this ligament? While we are having any movement of spinal cord, at that time it will keep the position of the spinous process in a same line, okay, perpendicular line. So that is the function of the ligamentum nuchae, ঠিক আছে? Throughout এটা ধরে রাখে spinal cord টাকে। Okay, then next one, what are the other thing we will get? So one ligament and another two muscle is, write it down. One is the interspinous muscle, between the spinous process, ঠিক আছে? আরেকটা হচ্ছে interspinous ligament. Don't confuse, একটা মাসল আছে একটা ligament, both are interspinous muscle and interspinous ligament. Okay, so these are the typical feature you have to say. And another thing is that how you will identify which lumbar vertebra it is, whether it is typical or atypical. By these two process. Okay, so if you see, ami kon lumbar vertebra could you tell? It is square shape. It is square shape. তাহলে এটা কি? এটা L4. Okay, so there is one rule how you will identify by the distance of the superior articular process and the inferior articular process. Okay, এটা কি তৈরি করছে তার উপরে. So write it down at first L1. L1 টা কেমন দেখতে হবে?
trapezium.
L1 to L3. Okay, L1 to L3 is almost same. L1 to L3 is almost same. So the distance of the superior articular process, the distance of the superior articular process would be more than the inferior articular process. This is the rule. Okay, so write it down. Distance between the superior articular process would be more than the inferior articular process. তাহলে তুই ভাব হরিজন্টাল লাইনে সুপিরিয়র এর ডিসটেন্স বেশি, ইনফিরিয়র ডিসটেন্স কম. সো হাউ ডাজ ইট উইল লুক? It is looking like a trapezium. Okay, it look like a trapezium. Next one is L4. Okay, L4 টা জানা উচিত কেন? Because both the distance of the superior articular process and inferior articular process is same. Okay, so for L4 the distance between the superior articular process and inferior articular process is same. Okay, next about L5.
Rectangle.
Here it is reversed. Okay, here it is reversed. So the distance between the superior articular process is less than the inferior articular process. Then the inferior articular process. Okay. এই রুলটাকে কি বলে? ফসেট. ওকে, এই রুলটাকে বলা হচ্ছে ফসেট রুল. ওকে, so by that way you could identify the lumbar vertebra. Okay, now we will come across the atypical lumbar vertebra. Okay, so which are then? Number 1, write it down. Atypical lumbar vertebra is L5. Okay, atypical lumbar vertebra is L5. এটা দেখে বলতো কত? বলতে পারবি? Obviously superior is more, inferior is less. Trapezium L1 to L3 এর মধ্যেই হবে, right? Most probably this is L2. ঠিক আছে? So L5 যেটা হবে atypical. What are the feature you will get? Number 1 is the body is much larger. Okay, so write it down. The transverse diameter larger তুই কি করে বলবি? How you will define it anatomically? So this is the transverse diameter. Transverse diameter is more than the anteroposterior diameter. Okay, so for L5 the transverse diameter of body is more than the anteroposterior diameter. So see, this is number 1 feature. Next one you will get this thing. So write it down. The superior articular process, the distance between superior articular process and inferior articular process is same. Okay, it is same and it is making a square shape. Okay, distance inferior is more than the superior articular process. Okay, then so you could see that inferior ta more, okay, than the superior one. Then the third one is about the spinous process. So spinous process, how does it look? See the spinous process? It is quadrangular? No, it is somewhat downwards. It is tilted somewhat downwards. Okay, it is projected downwards like other spinous process of the vertebra. Okay, so this is about the feature of the atypical lumbar vertebra. So you have to take about L5. Okay, now what are the other structure you will get on the L5? Okay, write it down. Oils. What are the structure you will get on the sacrum? Okay, sacrum এর anterior surface কোনটা এটা? So there are structure which are coming over here. This is known as promontory. Okay, this is known as ala. So here some structure are going on. So which are they? Number 1, write it down. Obturator artery. Then দুটো ট্রাঙ্ক থাকে, একটা হচ্ছে ইলিওলাম্বার ট্রাঙ্ক and another one is lumbosacral trunk. Okay, lumbosacral trunk. And last S means sympathetic chain. এই চারটে structure you have to tell if you are getting L5 or if you are getting sacrum. Okay, both. ঠিক আছে, so these are the four structure you will get on the L5. Okay, now coming to the ossification. So already I told you it ossified by, suppose this is a vertebra, how many primary and secondary center? There is two primary center, one for the body, another is for the arch. Okay, so write it down. It ossifies by, or it has two primary center, one for the body of lumbar vertebra and another one is for the vertebral arch. Another one is for the vertebral arch. And it appears during, কখন এইমাত্র বললাম কত থেকে কত ইন্ট্রাইউটেরাইন লাইফ 9 to 16, between 9 to 16 IU life, between 9 to 16 IU life. Okay, then what about the secondary center? How many are there?
7.
So total 7 for these 7 processes. Okay, for these 7 processes. And when does it unite? Primary center টা কখন fuse হয়? দুটো primary center বললাম, for body it will fuse at first year. Okay, and for the arch it will fuse 3 to 6 year. Write it down. Okay, for body it will fuse at first year of life. Okay, and vertebral arch it fuses 3 to 6 years of life. Okay, so what about the secondary center? There are 7 and when does it fuse? Approximately 25 years. Okay, approximately 25 years. So this is about the ossification. Okay, now most important thing about clinical anatomy. Write it down, clinical anatomy. Okay, so first one, tell me what is primary vertebral curvature and secondary? What do you mean by primary curvature and secondary curvature of vertebral column? So write it down, which are the primary curvature? Primary curvature. So what is primary curvature? If you see one newborn, okay, or baby, how it is present on the womb? Everything, the elbow, the knee, everything is flexed. Okay, what about the spine? Spine is just, it is convex throughout, right? So it is convex from cervical vertebra to the coccyx throughout. So this is known as primary curvature. Okay, so write it down. The vertebral curvature that develops during intrauterine life is known as primary curvature, and it is convex throughout. It is convex throughout from cervical to the coccyx. From cervical to the coccyx. Okay, now coming to the secondary curvature. Okay, so write it down, secondary curvature জিনিসটা কি? So afterwards, so throughout whole is convex. So generally in adult, which vertebra are convex? If you see the vertebral column, is it straight? No, it is S shaped. তাই তো? তো কোন curvature গুলো concave হয়ে গেছে? Throughout it is concave, right? কোনগুলো convex হয়েছে? Cervicalটা, আর কোথায় convex হয়েছে? Lumbar. These are the two regions. So these are known as secondary curvature. Okay, so এখানে ইম্পর্টেন্ট হচ্ছে কখন কোনটা ডেভেলপ করে, কখন সার্ভাইকাল কার্ভেচার ডেভেলপ করে, কখন লাম্বার, কখন সার্ভাইকাল বেবি দেখেছি সার্ভাইকাল কার্ভেচার কখন ডেভেলপ করে বল, হ্যাভ ইউ সিন? যখন যখন নেকটা ফিক্সড হয়, ওকে, when ক মাসে 6 মাস অবধি টাইম লাগে, 3 মান্থ। পিডিয়াট্রিক্সে এগুলো পড়বি, হ্যাঁ, when the baby have got social smile, suppose social smile, what is that? If baby seen somebody known, so he or she used to smile, so that is known as social smile. সেটা কখন ডেভেলপ করে? 2 মান্থ। Okay, then the next development is neck holding. Okay, so neck holding যখন হয় তখন cervical curvature develop করা শুরু হচ্ছে, কিন্তু শেষ কখন হচ্ছে? when it sits. Okay, so that is approximately 6 to 7 months. Okay, so write it down. Cervical curvature develops during 3 to 6 months. Okay, and what about the lumbar curvature? বসে তো গেল already. Now next step, what? Crawling. Okay, then next one is trying to stand, then finally walking. So when it does walk, okay, so that is about 18 to 20 months. Okay, 18 months you could say everyone is able to walk. Okay, so that is the time when the lumbar, so now we are associated with lumbar vertebra. When does the lumbar vertebra develops? That is at the age of 18 months. Okay, so this is the secondary curvature. Ar ki hoy? There are two things. One is lumbarization and sacralization. So what is that? At first we will tell about sacralization of lumbar vertebra. So write it down. What is sacralization of lumbar vertebra? So when L5 is fused with the sacrum, body of the sacrum, এর বডিটা এখানে গিয়ে পুরো ফিউজ হয়ে যাবে। Okay, so that is known as sacralization of lumbar vertebra. Sacralization of lumbar vertebra. And sometime what will happen? This part of the sacrum, okay, superior part of sacrum will fuse with the lumbar vertebra. এখানে একটা there would be one thing, okay, in between there is one distance between this superior part of sacrum and inferior part of sacrum. Okay, তো তখন আমরা তাকে কি বলবো? লাম্বারাইজেশন অফ স্যাক্রাল ভার্টিব্রা। ওকে, তাহলে স্যাক্রালাইজেশন কার হয়? লাম্বার ভার্টিব্রা, আর লাম্বারাইজেশন কার হয়? স্যাক্রাল ভার্টিব্রা। সো জাস্ট রিমেম্বার দ্যাট থিং। ওকে, another one is, you know, here is which thing is coming out? This is what? This was my thesis topic. This is the sacral hiatus. Okay, so sacral hiatus, which thing is coming out? Suppose the spinal cord is finished at the level of L1, but instead of that, this sacral canal is wide open. Okay, so this part there is chorda equina, lower part of spinal cord and meninges. So this part is wide open and some tumor also coming out. So that is known as meningocele. Okay, so write it down. What are the different feature you will get? First one is meningocele. What is meningocele? So when the part of the spinal cord protrudes out, when the part of spinal cord protrudes out of this sacral canal, so that is known as meningocele. Okay, so you could see, able to see, have you seen in this congenital anomaly? Today do one search, you are using net for unlimited times, so just search what is meningocele. Okay, so you will see some kind of tumor. This is a congenital anomaly. Okay, that would be found on the lower end of back. Okay, so that is known as meningocele. Next one is meningomyocele. Meningomyocele. So what is meningomyocele? whenever the part of spinal cord along with meninges protrude out. Myo মানে কি meninges, along with meninges, okay, along with meninges protrude out, that is known as meningomyocele, okay. And another variation is spina bifida, okay. So what is spina bifida? Tell me what is spina bifida and bifid spine, what is the difference? So this is which vertebra? This is the cervical vertebra. So if you see the spinous process, it is bifurcated, okay. We will term this one as bifid spine, okay. Kintu spina bifida is type of a disease, okay. In this case what is happening? In this case what is happening? The part of the sacral hiatus is more enlarged, okay. This whole spine there would be eroded, okay. So that is known as spina bifida. And if the part is not seen from outside, that is known as spina bifida occulta. Occulta means something is not seen from outside, occult, okay. So write it down, spina bifida occulta. If the part of spinal cord is not seen from outside, in case of spina bifida, so that is known as spina bifida occulta. Okay. Now there are three bending, you know, bending of the spinal cord. So what are they? Vertebral column, number one is kyphosis. So write it down, kyphosis is forward bending, forward bending. So what is normally kyphos position in vertebral column? Already forward e ঝুঁকে আছে, সেটা কি? thoracic, তাই তো, সামনের দিকে অলরেডি আছে। তো কোন পজিশনটা হবে? both this lumbar and the cervical, ঠিক আছে, সামনের দিকে যাবে। So that is known as forward bending, so that is kyphosis. And if it is backward bending, that is known as lordosis, lordosis, okay. But for lumbar vertebra you have to study scoliosis. Lateral bending কোথায় হয়? শুধুমাত্র lumbar vertebra, okay. So scoliosis involved only the lumbar vertebra. So this is the lateral bending of lumbar vertebra is known as scoliosis, okay. আচ্ছা, আরেকটা জিনিস লেখ, আরেকটা জিনিস, which artery is related to the lumbar vertebra? Which is the major artery that is related to lumbar vertebra? L1, L2, descending thoracic aorta, okay. So write it down, descending thoracic aorta. So in case of aneurysm, what do you mean by aneurysm? Dilatation of the artery, okay. In case of aneurysm, there is erodation of the lumbar vertebra, তাই তো। তার মানে নদীর জলও, we have seen the rivers are also making impression on the stone, right? The same like this extra blood volume, that will also having impression on the lumbar vertebra, okay. It used to erodes, okay. So in case of descending aorta aneurysm, okay. So these are the clinical anatomy you will get in the lumbar vertebra, okay. So main identification point of lumbar vertebra, you have to say, make a gist, body is massive and reniform in shape. What about the vertebral foramen? If you see the vertebral foramen triangular, then you have to mention mammillary process and accessory process and the attachment of these thoracolumbar fossa, and most importantly the superior articular process and inferior articular process, okay. So this is the identifying feature for lumbar vertebra, okay. Thank you.